Hi everyone, my name is Zachary Yuan, and I'm the president of the International Youth Neuroscience Association Hong Kong chapter. In partnership with Hatch Hong Kong, the hub of advanced technology for child health, today we're really pleased to have Dr. Oscar Wong here with us to talk about his career and research as a psychiatrist. To start with, I'm going to introduce Dr. Wong. Dr. Wong is an assistant professor of psychiatry at the Chinese University of Hong Kong. His research mainly focuses on autism spectrum disorder, neurocognitive function, child and adolescent mental health, and the microbiota gut-brain axis. Dr. Wong is highly involved with the Hong Kong College of Psychiatrists as well as the International Society for Autism Research. He's also leader of the Hatch Clinical Research Team, which is mainly responsible for ASD-related research. In addition, he was presented with the Distinguished Young Fellows of Hong Kong Academy of Medicine Award in 2023. Dr. Wong, it's a pleasure to have you here today.
Thank you, Zachary. Thank you for having me today.
Mhm. Why don't you tell us a bit about yourself and what you do?
I am actually a psychiatrist. So I went to medical school at the Chinese University of Hong Kong and graduated in the year of 2010.
Hmm.
So I've been practicing for more than 15 years right now. So um, so after I graduated from the medical school, I chose psychiatry and then got trained to be a specialist under the scheme of the Hong Kong College of Psychiatrists. And then after I got my specialist qualification, I then went back to the academia. I took up a job as an assistant professor in 2019, just before COVID hit us, and then embark on a journey of research with a primary focus on child and adolescent health and also autism spectrum disorder. And then right now I'm doing multiple jobs, I would say. I have multiple duties. I have to teach medical students. I have my regular clinical works, which involve seeing my outpatient clinic, and I also supervise my trainee to handle patients who are admitted to the psychiatric hospital. And then besides teaching at the university, of course, I have to do research right now, as I just mentioned about the focus on the child and adolescent population and autism, and also the microbiota research. And there are also a lot of administrative duty. I'm actually also involved in the admission team where I regularly interview high school applicants for medical school to get into our faculty. So yeah, just a brief introduction to what I'm doing right now.
Yeah, sounds great. I guess a lot of people are wondering like why would you choose to become a psychiatrist? Like what does being a psychiatrist entail?
So actually, a lot of my peers, when I went into medical school, they choose the specialty along their journey through the medical school, because in the medical school you're going to expose to a different specialty, and then some people actually choose when they graduate. After they graduate, they have to go through this 1 year of internship, and then there are full rotation where you are going to actually practice in the different specialty, and then that experience usually shape what eventually you would choose. But for me, I'm a little bit different. I basically when I have to decide for my undergraduate, I'm choosing between psychology and medical school, and then I eventually took up the medical school. I know that I'm pretty interested in human behavior. I like understanding how people interact with one another, and that's why I'm more inclined to that stream. But then I eventually took up the medical school, as I'm also very interested in biology and also how things actually work in a more like a physiological way. But I think the main reason what motivates me to take up psychiatry is because throughout the years, I think even up to now, is that I'm seeing a lot of a stigmatization around the world in the society against these people who so unfortunately suffer from different degrees of mental disorder. There are a lot of reasons why this stigmatization happens, but primarily I think is the misunderstanding, which creates a lot of like fear, and then you want to exclude these people from your like immediate surrounding environments, and which creates even more misunderstanding because you don't have the chance to really get to know what it is like to have mental disorder. And I think this kind of like a prejudice and stigmatization is giving even more like a burden to those who suffer from psychiatric disorder. And sometimes it creates such a huge problem because like psychiatric patients do have self-stigmatization as well because they know that people are rejecting this labeling, even though they experience something not quite well with their mental status. They fear that as you see a psychiatrist, you got labeled, and then people start recognizing you, they would start to reject you. And sort of it creates a barrier for them to seek for proper help. And then we know that like delaying treatment basically could be very detrimental to your long-term like recovery process. So I think it's very unfair for the people who suffer from mental disorder. Their experience is horrible enough, and then the reaction from your immediate environment, if it creates a barrier for you to seek for proper help in order to gain recovery, I think that's not very fair. So that's why I decided to choose this discipline in the hope that we can like make the society a more accepting and a less misunderstanding one to like improve the mental health of the whole like community. Yeah, that's the
Yeah.
story.
And and you've done quite a bit of research on in this area too, right? Which we're gonna talk a bit about later.
Yeah,
But just one sort of clarifying question. You mentioned you've well, you looked into the School of Medicine and also
yeah.
psychology. So a lot of people like mix up like being a psychiatrist and a psychologist. Like what really is the difference between these two, and also in Hong Kong and overseas?
Right. I think that both in Hong Kong and overseas is pretty similar. So a psychiatrist as a medical doctor, they have to go through the proper medical training, got their MDs or what we call MBBS or MBCHB in Hong Kong. So you're trained actually in different discipline, and then you are qualified to prescribe medication. And then after you graduate, just like other specialty, you went into a stream to get like a postgraduate training. So usually the pathway of becoming a psychiatrist is pretty long. So in Hong Kong, and there is like 6 years of medical school, and then 1 year of internship, and then 6 more years of like a postgraduate training on psychiatry. So it took you around 13 years before you can call yourself a psychiatrist. And then the job of psychiatrists is that, of course, we see mental patients, we can prescribe medication, and we also conduct like psychological intervention. But due to the, I think in Hong Kong, the resources limitation, we are very short of like a psychiatrist, and then psychological works actually could take quite a little bit of time. Psychiatrists may not have sufficient space and time to conduct like a very in-depth psychological treatment, but we do know the principle, and then we work with a lot of psychologists to, as a team, to help people with like mental sufferings. On the other hand, like psychologists, they are not medical doctor, but they are trained professionally in the discipline of psychology. Usually, they start off like with an undergraduate bachelor in psychology, and then in Hong Kong, they have to undergo 2 years of postgraduate master training. Um, I think in the US, it's a doctoral degree. You have to get to like a doctor degree for psychologists in order for you to become a psychologist. And that doctoral degree is pretty tough. I heard that you have to get into very do a lot of research as well as clinical training before you can become a board certified psychologist. Whereas that of in Hong Kong, since it's only a master degree, it's mostly practical training. You still have to go through some thesis and a little bit of research, but of course that's not up to the scale of a doctoral like psychology program. So I would say 2 years is pretty intense. These 2 years of training, you have to rotate through different discipline and specialty, and then you will become a board certified psychologist. And then in Hong Kong, there are different types of psychologists. Most well-known type are the clinical psychologists and then the education psychologists. So clinical psychologists, basically, they can do a lot of assessment as well as delivering therapy or treatment using different school of psychological treatment, such as cognitive behavioral therapy, psychodynamic, family therapy, etc., etc. While that of for education psychologists, they are more for children or adolescent at school. It's more assessment based, so they usually do diagnostic assessment or conduct assessment for special education needs, IQ assessment. Yeah, so there are different streams, but the main difference, to put it short, is that psychiatrists are doctors. They're qualified to prescribe medication. They're also trained to deliver psychological therapy. But in Hong Kong, at least, usually they may be more inclined to usage of medication, and then they work with the psychologists who are more trained, concentrate on delivering like psychological treatment, and that's the main part of the job.
And correct me if I'm wrong, but you're a clinical psychiatrist, right?
Yeah, I'm a psychiatrist, so I'm a graduate from the medical school, and then I took up the psychiatry as my specialty.
Oh, so it doesn't matter if you're like a clinical psychiatrist or an educational one. You
No,
do
no, no.
both.
The education and clinical is only for the psychologist,
Oh,
not the
psychologist. Right,
psychiatrist.
right.
Yeah, yeah,
Okay.
yeah.
Yeah. Um, so yeah, why don't we talk a bit about like the research that you do, right?
Mhm.
Well, a big part of your research is related to autism spectrum disorder
Yeah.
and child mental health. So why don't you like talk about what you've done in those areas?
Yeah, so since I took up the academia job, I start on research on autism spectrum disorder because I find it very fascinating. So basically, there's a lot of unknowns. What causes autism? Is autism necessarily a disorder? I think in the society there is a lot of like different voices as to how we should conceptualize this condition. Some people would um, identify autism as just a human trait. It's no different from like a different dimension of our personality aspect. Some people just are not that sociable, and then they may have this very specialized mindset that perseverate a lot and do very detail-minded things. While on the other hand, as a clinician, I do see a lot of children and adolescent or even adults with autism. They do suffer a lot. They have a lot of needs, uh, whether it is from their education or their mental health needs. There are like real needs of mental health treatment. So in a way, they are having a condition like disorder level of condition. So autism is really a very wide spectrum, and then I was very fascinated with these. Why is there such a huge variability, even though they are subsumed under the same name of ASD? So my research focused on that. I tried to explain the so-called heterogeneity of ASD, and then my choose of like an instrument is that I want to understand from like a more neurocognitive, more biological way, and then try to understand how different level of like cognitive functioning maybe mediates on thing on the different clinical outcomes. That's one of my first focus of research area. But then, like several years back then, when we established this hatch project, which is the Hub of Advanced Technology for Child Health. At that time, our dean of medicine in the Chinese University of Hong Kong, Professor Francis Chan, who is a gastroenterologist, he had a very special interest in the gut microbiome, the bacteria and viruses in our gut. And then there has been increasing evidence to show that the gut health actually influence a lot on our different bodily system, including the that of the brain, which we now known as the microbiota gut-brain axis. So there has been some animal study that is very interesting that you isolate the gut microbiome from the children with ASD and then transplant it to a mouse gut, and then it sort of induce autistic-like behavior. So that was very fascinating because it sort of gives us a glimpse onto what we have been trying to understand for decades, which is the cause of autism. So some people postulate that autism could be caused by disturbance of gut microbiome, and then there has been some human study that try to test out whether it is the case or not. So I would say right now we still don't have a concrete answer yet, and it's very debatable, and there is a lot of controversial discussion about this topic in the scientific world. But we see the chance of harnessing the gut microbiome as an intervention portal, since the gut microbiome could be treated, it could be changed with a lot of methods. And then if eventually we can find something that contribute to the diverse clinical presentation of autism, which I've mentioned, then that would be great. I can maybe try to modulate the gut microbiome in order to optimize the functioning of these individuals with autism. And that's why we start this CUHK cohort. So around in 2021, we accept a very large cohort that is more than 2,000 children with and without autism. And then we collect the stool samples and then profile them clinically with a lot of parent-filtered questionnaires. And then we try to first of all identify whether there is such a thing called a microbiota signature of autism. By identifying this signature, we may be able to devise some diagnostic markers, because a lot of psychiatric disorder right now, we are lacking of biological markers to aid clinician for accurate diagnosis. So for autism, since it may be related to the pathogenesis, the disease disorder development, we think that by identify more consistent signature, we can develop a stool test that may have predictive values of a future diagnosis of autism. So that's the first goal, that we have succeed in identifying a microbiome signature after several years of research developments. And then the result was actually published in an international journal article last year in Nature Microbiology. So we are on the roadmap of devising actually usable clinical tool just based on a very simple stool test. We hope that eventually we can identify who are the children, especially when they are still very young, that is going to develop autism. By doing early identification, we hope that we can do early intervention as well, so as to optimize the outcome of these children who are at risk of a lot of needs. So that's the first part. The second part of the CUHK cohort is, of course, we want to do, besides the diagnosis, we want to do some intervention. And then our team made a novel probiotic regime that targets on some of the very specific symptomatology of autism, including that of the sensory hyperresponsiveness, because a lot of autistic children, they do suffer from a lot of sensory symptoms, they are very sensitive to environmental noise. They're very sensitive to touch. For example, they don't like to wear certain clothes that are made of wood that irritates them and make them having a lot of emotional response. And then we devise a formula that upregulate certain like bacteria that is associated with these kind of like symptoms. And then we run a very small scale pilot study and then find that there is some positive result that may shed light to like possible like therapeutic effects with this sort of intervention. So that's about HATCH. The study is expanding. We are right now including more and more children to dive into this field, which is very exciting. It's very controversial. We don't know much about it, but we are trying to gain more scientific understanding through this like very large scale. I would say this actually right now the world largest cohort that studied the microbiota brain access in autism. Yeah.
Hmm. Yeah, that was really interesting. Could you tell us a bit more about like on the parents and caregivers side, like the importance of of having like educational talks for them as well to help these children with
Yeah,
ASD?
sure, sure. So right now we don't have a cure for autism, and then also like we are also very biased against autism. We tend to think it as a negative terminology. I think at least in Hong Kong, I don't know much about like in the US. I probably in the Caucasian country it is better. I don't know if you have heard of the term like neurodiversity, which people are starting to advocate embracing like autism as I said, part of just normal human continuum. But I would say in Hong Kong, like still this culture is not very well established, and in effect, like taking care of children with special education needs could be tough. So the parents they often had a lot of like a caregiver burden and stress, such that they have their own mental health needs as well. But then oftentimes they tend to be not so aware of such. And then this emotional burden of caretaking could translate into detrimental parental-child interaction because the more stressed you are, the less able you are to like exert your proper parenting and may oftentimes lead to a lot of conflicts, and conflicts could lead to even more behavioral problem of the child as a way of like antagonizing. So it again go into a bit of like a vicious circle. So what we are trying to do is that we want to break this cycle by properly educating the parents about the condition, how we should like besides hoping to like get the child improve on their behavior, that we shouldn't forget that they should be respect as an individual, and then we should like sort of appreciate their unique aspect that is not just like characterized by their autistic features. So autism is just a part of the child, it's not the whole, right? But then parents who are stressed tend to magnify the problem to the max, such that autism become the child, which is not very healthy. And then what we do is we try to educate them to be aware of their own emotion reaction as well. Because if you are not aware of your own emotional reaction, then you are at the risk of acting upon your emotion without awareness that leads to a lot of conflicts and the behavioral problem that just talked about. Yeah, so I think education is a very important aspect for taking care of like children with autism and other neurodevelopmental condition.
And you've done like some like projects related to this. I think through like um, a couple of mobile phone based intervention apps. Um, could you
Yeah,
talk a bit
yeah.
about those?
So thanks to COVID, actually, if it is not COVID, then I think we wouldn't transform a lot of things into digitalized platforms such as Zoom, what we're using now, so convenient. Probably is because of COVID. So it was also at that time that we realized we can make very good use of our mobile phone as a way of intervention for mental health because this is so accessible. Everyone now doesn't, there's nobody who doesn't live with a smartphone. So we use this portal to make an app so as to cater to the parents' needs. So the needs are multifaceted. First of all, their own emotional needs, their need for how to take care of their children properly, and also the schedule. Because if you have the right materials, which is not lack of out there, there is a lot of courses that you can enroll on how to be a good parents. But then, busy parents, especially in Hong Kong, they're working. Afterwards, they have to rush back to the home to take care of the children. Basically, they don't have the time to really get enrolled to this regular course. So mobile phone becomes a very accessible portal since it could be flexibly catered to the agenda, the schedule. So we devise these two apps. One is more for general parenting, while one is more for parents with children who have ASD. Both of which the backbone is a mindful parenting. So mindfulness is another very popular like um, um, school of a psychological intervention that in the recent decades it's gaining more recognition as a way to like um, improve some of your common mood problem such as depression and anxiety. The principle is really to become more aware of your own emotional state, more acceptance, you just be there in a very non-judgmental way. So this is what we want to cultivate, right? As I said before, the lack of awareness of your own emotional state, could jeopardize the parent-child relationships. You will want to, like, besides skills transfer, educating parents how to take care of the kids, we want to also reinforce the importance of self-care. Reserve some time for you to be talking to yourself to learn about what kind of emotional state you're being in right now, and then to take a step further by awareing the emotional state of yourself, you can further be aware of how your emotional state may influence your relationship with your child. So we devise this app as a course. This is we have a fixed curriculum. It takes around 6 weeks for you to complete for the version that is adopted for children with ASD. So each week we have a different themes, different areas that we want to focus on. Sometimes it's more about mindfulness. Sometimes it's more about how you resolve conflict with your child. Sometimes it's more on some educational materials on specific symptom domains of the children with autism. So um, right now, our team has completed clinical trial in Hong Kong for the mobile phone app, and we have done some very preliminary uh, statistical analysis of our data, and then found that those parents who use this app throughout the 6 week, they would have decrease of their anxiety and depressive symptoms, and then also boost up their sense of competence, and then lessen of their parental stress that could be sustained until 12 weeks, 3 months after they start to use this app. So we're pretty encouraged by this result. And right now we only have a Chinese version of it, but I'm gathering different collaborators internationally through my connection with the International um, Society for Autism Research. We hope that eventually we can get to multilingual version and then disseminate it in different parts of the world. Yeah.
Yeah, that's a great initiative. Um, you also you talked about the gut microbiome before.
Yeah.
and the trends that you've seen through the research. Could you tell us a bit more about your research on the gut-brain axis and what you've discovered?
Yeah, so far, what I've told you before is about identifying the microbiome signature, and then we do a little bit of like a intervention trial, but then we are still like unresolved on like whether the gut microbiome is actually causing microbiota, or to me, my question is like if it like contributes to a bit of like the clinical picture, how does it actually contribute? So we are dissecting a lot of like the like because we our hatch cohort, there are very multi-dimensionally like phenotype. So we are using a lot of like advanced statistical analysis to pick out like which are the symptom domain that are more correlated with the disturbed gut microbiome composition in this kid. So to identify certain specific pathway, which might inform like in the end, if we are to use the like gamma microbiome as a treatment, which aspect of like ASD we would have expectation that would have a expected greatest results. So this is what we are trying to do. In long term, because this hatch code is longitudinal in nature, we are trying to also like see if we can like identify some prognostic markers from the gut microbiome. Like if you have like certain bacteria or viruses in the gut, it could point towards different trajectory. It's not just about the poor trajectory, but we also want to identify those who have like favorable outcome because a lot of autistic children, they actually grow up to be very independent and very skilled personnel. So we want to know like whether there is a mediation effect by the gut microbiome that determines the like longitudinal trajectory. Again, informing us like how can we can optimize, for example, the gut microbiome in order to improve outcome. Of course, there's a lot of like exciting things that is happening in my lab. Although majority of the part is on gut microbiome, I'm also like investigating on like how autistic children could understand emotion. Like in the past couple of years, I've been trying to establish Hong Kong emotional face database. I've invited hundreds of like professional actors and then try to act different like emotion and then capture the photo. This is very relevant for autism because a lot of autistic kids, they do not know how to read emotional cues. They do not know whether one person is like angry, having different emotion, because they simply somehow do not recognize it. So we have like established this database, and then right now we are in the process of like validating this database, and hopefully it will turn into a very useful research instrument that we can go into the more details of how the gamma microbiome could even associate with the specific mechanism of like a facial visual perception. Yeah.
Yeah. Um, I think we've covered like most of the research that you've done. Is there any other sort of findings that really like excite you or really struck you that you found?
Yeah. So as I said, like autism is really a spectrum. So as I mentioned in the beginning, like there could be cases, children that is really like having a lot of problem, a lot of struggles, a lot of like family difficulties. Whereas there's another spectrum of like that are like more favorable. So my latest research really is to answer since in I think in the past decade in research of gut microbiome in autism, researcher tends to just think like autism is just one thing. It's one or zero. They neglect this very multidimensional heterogeneity. And then my current work actually try to dissect out this clinical heterogeneity. And then we stratify our catch cohort into different classes of severity, and then found that actually the gut microbiome, even within ASD, is quite different from one another. And then within that, we try to tease out which are the specific mechanism that could cause certain symptom domain. And then we find out that actually the sensory symptoms, which are so common and so debilitating, is most associated with the disturbed gut microbiome. So we think that it might be the pathway whereby in human um, gut microbiome could contribute to some of the clinical manifestation. So this is very exciting for us, and then we are yet to validate it. This study result in independent sample, and then we are also collaborating with a lot of basic scientists who we in Chinese University of Hong Kong. We have a very large animal study lab. We are going to test out these hypotheses from the human into the animal to see if we can really replicate the findings and also understand the specific physiological effect from the animal models.
Mm. Yeah, really exciting to see what could happen in the future. Um, why don't we talk about more about like you and your experience being a psychiatrist now?
Right.
For like a question that I have is like, are there any challenges that you faced in your path of being a psychiatrist, and what makes you persist through?
There's a lot. Like every day, I think psychiatrists face with a lot of uncertainty. Like we are very almost never be certain of who will respond to our treatment because our understanding to the brain is still very a basic, unlike a lot of other discipline where there is a lot of fancy instruments that could help clinician to make judgment. We psychiatrists still is pretty stuck at the behavioral end. We just relied on our own observation and make our clinical judgment. So a lot of the times we could guess it wrong. Like even for making diagnosis, sometimes the clinical picture changes and we don't know exactly why sometimes the treatment does not seem to be working for certain patient while it works for the others. So yeah, so that's the difficulty, but it's also the part of the beauty that I think is what makes psychiatry so interesting is because we can continue to learn. There's a lot of a room for discovery. I think that is what sort of drive me. Like the difficulties is actually part of the drive, I would say. But at the same time, again, back to my the beginning, the primary reason why I work into this field is because I want to contribute. I see the difficulty. I don't want um I don't think that the prejudice against him is justified. So I still want to work in this field to improve the mental health of the whole society.
Right. And could you talk about one of your like more memorable experiences as a
Hmm.
psychiatrist?
Maybe I couldn't get into the very specific details because it may involve a lot of confidentiality issues. But I think I would say I actually learn a lot from my patients. I would say that a lot of the times, even though they have a lot of difficulties, they're actually way more resilient than what we are. I couldn't imagine if I were part of the what happened to them, whether I would be very like brave enough to survive as they are, but they somehow could master their resilience altogether. And then as a psychiatrist, we are just sort of be there for them, give a little bit of advice, try to accompany them through their own struggle and journey. And then this really inspired me a lot, actually. And then I sometimes am humbled by my patients, and then it sort of reflects on my own difficulty. Sometimes in career as academics, it's full of challenges, full of failures, full of rejection. And then I would remember my patients. They teach me how to be brave and how to be resilient, how to carry on despite all the adversity out there.
Hmm. Um, and also, like, what do you think are some qualities of a psychiatrist? Like, you're surrounded by so many psychiatrists around you. What do you think is something that you see among all of you?
Hmm. I think curiosity is definitely one. Curiosity as to like into other people. Like you want to get into very deep understanding of like what actually happens to your patient. And then you have to tolerate a lot of like ambiguity. Like if you want things to be like very exact, very predictable, then maybe psychiatry is not really something for you. If you can tolerate ambiguity or even enjoy a little bit of like uncertainty, which actually happens all the time, like in our life, right? So if you like enjoy like this kind of exploration with a curious mind, and then also you are a people-oriented person, like you can get in touch with other people, and then people um, often say that like they feel comfortable after talking to you, then maybe you could think about like psychiatry. But I would say like psychiatry is not a specialty that is like a I would say a lot of medical students that I teach either hate it or love it. Like after experiencing like psychiatry, they would immediately know say, okay, I see what you mean by the like difficulty encountered by my patient, but I'm really not the kind of person who would want to like get into this very messy, very dirty, unclear, and then ambiguous specialty that they sometimes have a sense that they couldn't grasp anything. But then to me, if I'm more like people oriented and if I'm more grounded to like curiosity of other people's life, then I find it very fascinating. And yeah.
Right. And speak to your past, right? Speak to you as a student looking
Mhm.
at a future career in psychiatry. Like what would you say to your past self?
Past self.
Yeah, to be like sort of prepared to be a psychiatrist or pursue this career.
I think exposing is really definitely going to help you a lot. Um, I don't know how it is in the US, but in Hong Kong, in the 6 year of medical school, you are only given like 8 weeks, only dedicated to psychiatry. So the scope is quite limited. And then our goal of our psychiatry module is basically just to equip you as like a non-specialist to know how to deal with psychiatry in a non-specialist setting. So it could be very superficial. And then if you want to get into like a better taste of like what psychiatry really is, there is a lot of chance that you can do. It's not just about like applying for clinical attachment. I'm pretty sure that there's a lot of like voluntary work whereby if you can go into the people on the more like a disadvantaged socioeconomical class, then you are going to encounter a lot of people with psychiatric needs, and then you can begin to understand why these people suffer and what exactly are they suffering from mentally, and then go to some community center, go to the rehabilitation service, or even into some like center that is for like a substance abuser, and then you understand like what kind of like clients that you are going to face if you are to take up this specialty. And then after all, our center is like outpatient. If you don't feel like working with them, then probably this discipline is not for you. But exposing to like non-hospital setting psychiatric patients is also a chance for you to gain a more like a dimensional and more like holistic view of like what our patient's journey um, would be like. So I will encourage for those of you who are considering this like specialty, just go to like get into the society, get to know what's happening to them. Even I think for like a case of fentanyl, like I think it's quite prevalent in the US. Like get to know what is actually being done in the society and why do people are so addicted to this kind of substances. it's a way for you to understand a little bit of like the very complex interface of like psychiatry and the society. Yeah.
Yeah, that's really helpful. Like you gotta leave your desk sometimes, be more hands-on,
Yeah.
see what's happening around you. Yeah. Um, I think a lot of people watching this video are sort of interested in looking into like um medicine or like medicine at CUHK. Like, what would you say, like, what would you say like as a tip for them going through this
But just
process?
for medicine in general.
Yeah, or medicine, psychiatry, like just a lot of people are looking into like studying
Hmm.
at CUHK medicine, I guess.
Well, I think, of course, like medical school is tough to get in.
Hmm.
So very essential prerequisite is that you have to demonstrate your academic excellence. So the public exam, that sort of stuff. I don't want to spend time talking about that,
Yeah.
but getting into medical school is just one of the first step. The subsequent 6 years application and then lifelong learning, I think is very essential for one who consider like who are considering to be doctors to know exactly what is your reason. Like that really could motivate you to like fight against all the difficulties, challenges, and adversity through your lifelong medical journey. It's not really just about the admission. The admission part is relatively easy, but you'll have a lot of like self-doubt. You will have a lot of like failures and then challenges um, that no matter how like talented you are, if you do not find the reason to be in this very challenging field, um, you're bound to like have times of like a burnout and then a lot of like occasion that you may want to give up entirely. So it's always good to like reflect on that. I think it's a very personal reason. Like not every one of us would have like a very uniform way of like why I become a doctor, but it's a question to ponder on, like whether you know exactly what's is to be a doctor and why you want to choose this very like difficult like discipline.
Hmm. Yeah, it's about like being passionate about what
Hmm.
you're gonna study, right? Well, I think that reaches almost the end of the questions I have. Is there anything else that you wanna share?
Mm, well, just one thing as part of my job, I would really hope that every one of you out there who are listening try to think whether at certain points of your life you may have like sort of unconsciously or consciously add to the stigmatization against those who suffer from like psychiatric illnesses. Try to remember that even though on the behavioral front, you might observe that these patients are a little bit, they could be a little bit weird, they could be a little bit different from you, and then you think that they may not be making a lot of sense. But behind these like behavioral fronts, oftentimes there is a lot of like sad story behind which you wouldn't want to experience. And then you want to appreciate how resilient that they are right now, still standing up here, surviving, and then try to cultivate a more accommodating society, which might eventually benefit these patients.
Right. I have one more sort of fun question for you. There are a lot of like big words in medicine. What's your like favorite like medical term, medical word?
Medical term, I couldn't like no, but I think in the past couple of years, I'm always very obsessed with this terminology of heterogeneity. Like we shouldn't use just a label to cover the whole diverse presentation or just about human race. We shouldn't use like fixed terminology to like overshadow everything and then forget about the individual characteristics which we all like treasure. We humans should be diverse. We don't want to have like a very narrow mindset to see our differences.
Right. Yeah. Um, so I guess that reaches the end of this interview. Thank you,
Thank
Dr.
you.
Wong, so much for taking the time to share about your career and your research today. It was very insightful to me and also to other students who are looking to pursue a path in
Sure.
career in psychiatry. I also want to thank Hatch Hong Kong for making this interview possible. And yeah, we are the Hong Kong chapter of the International Youth Neuroscience Association. We're an organization dedicated to raising awareness of mental conditions among the Hong Kong public and inspiring the next generation of neuroscientists. So, thank you so much for watching, and thank you, Dr. Wong, and stay tuned for more videos like this. Yeah.
Thank you for having me again.
Hmm. All right.
All right. Bye.